Hi guys, Dr. Yalda here from the Beverly Hills office, and today we're going to talk about what can happen when you don't extract a tooth soon enough and you don't replace the adjacent teeth. So in this case, we have a patient here who presented to us with a broken tooth on the lower left side. Now, if I subtract the top arch of his and I just kind of zoom in and show you what this looks like, this patient had a cracked and broken tooth, and that tooth has actually been there for a long time. Not only does that tooth have an infection, but it's actually caused a lot more harm than that. If I add the top arch back, you can see that this upper second molar has actually suffered more. What's happened here is this tooth did not have a neighbor below it because the tooth underneath was broken and it actually supra-erupted. Supra-eruption is a combination of gravity and the tooth just growing into that space that's available to it. So here you can see, if I highlight this patient's topography map, which shows the bite and the occlusion of where they're meeting, you can see that this upper tooth now has all of this recession, roots showing, and is hitting this lower tooth completely. All of these darker spots, the sunset colors, that's where you're seeing a very heavy bite. So now, unfortunately, the solution here really is that this tooth is going to have to be removed just because of the lack of attention to the tooth below it. Had this tooth been extracted sooner, had an implant been placed there, that would have kept this tooth up and at bay, and we would have been able to have a functional second molar on the top and bottom. But unfortunately now, this tooth is planned for an extraction as well as the bottom that's broken. We're planning on placing an implant right on this side, and on the other side, there are already 2 implants placed that we'll be restoring so that the patient doesn't run into the same issue with these lower 2 teeth, because lower teeth can also supra-erupt at a slower rate because the bone is more dense and you don't really have gravity working with you, but they still do supra-erupt. So we will still be able to give this patient a beautiful smile, but had we restored that back tooth sooner, he would have been able to keep an extra tooth.